Good morning, good afternoon, or good evening, teacher. My name is Maria Jose Romero Navarro. I'm from the 10th grade, and today I'm going to explain how do we breathe. So let's go. The key of respiration. Respiration can happen in unicellular organisms and in multicellular organisms. In unicellular organisms, it's very simple because the respiration is directly, but in multicellular organisms, it's a little more complicated because there happen the change of gases. What is this? This is this is when the oxygen and the carbon dioxide play a very important role because our cells need oxygen to survive and to work. So they have to take it from the air we breathe. And also they produce carbon dioxide through some chemical reactions, and how the carbon dioxide is toxic for our body, they need to expel it. So for this process, we need two systems, the respiratory system and the circulatory system. The respiratory system is when an organism takes breath from the exterior, then captures the oxygen. This oxygen passes through the blood to recover the carbon dioxide that have to be expelled to the air. And the circulatory system, through a medium of transport, carry the oxygen for the rest of the body and collect the carbon dioxide. So the most of time I thought that respiration was simple, that you just breathe and that's all, but no, we can see it's a little more complex. So the respiratory movement. There are two respiratory movements, the inhalation and the exhalation. The inhalation, in few words, is the taking in of air so it can enter to the lungs. And what happened here? The lungs swell. The muscles that are related with respiration work to broaden the, the thoracic cage. Also, the diaphragm contract and decrease the intercostal muscle tense, lifting the ribs. And in the exhalation, is the expelling of air so it can leave the lungs. And what happened here? The lungs, the diaphragm, and the intercostal muscles relax. The size of the thoracic cage decrease, and the rectus abdominis muscles pull the ribs back. So now we are going to talk in more detail about the exchanging gases. So the exchange of gases between the air and our blood happens in the alveolus. And what are the alveolus? The alveolus are small sacs that are in contact with numerous blood vessels. And how it is related to the exchange of gases? Because the blood that reaches the alveolus through the veins is low in oxygen and high in carbon dioxide. But in each time that the blood passes from each alveolus, the carbon dioxide diffuses from blood to be exhaled to the air, and oxygen diffuses into blood from the air. So now the blood that leaves the alveolus is going to be low in carbon dioxide and high in oxygen. And this, you can see all the process in the photos that are here that are very explicit. So then when this blood leaves the alveolus, can return to the heart, and when it pumps, the blood and the oxygen is going to reach the rest of the body. So now, to finish, we are going to talk about the respiratory rate. What is this? In few words, it's the number of inhalation per minute or the number of breaths per minute. And it's not a constant because it varies depending on the oxygen requirements that we need. So, as you can see, depending on the age of each person, the respiratory rate is going to decrease or increase. For example, I'm 15-year-old, so my respiratory rate is going to be between 12 and 20 breaths per minute. But for example, it could vary if I'm going to run, if I'm going to the gym or to do any sport, because how my muscles are going to work more, I am going to need more oxygen, and how I'm going to need more oxygen, I have to breathe faster, and how I have to breathe faster, my respiratory rate is going to increase. So it's not going to be now my respiratory rate for of 12 to 20 breaths per minute. Otherwise, it's going to be, I don't know, between 35 or 14 breaths or inhalation per minute. So it's the way it could vary. And now we finish. Thank you very much. Thank you for your attention and goodbye, teacher. I hope you have a pretty good week.